Happy Women's Month on the 9th of August 2020. Malibongwe, igama lamakhosikazi. My name is Dr. Nomonde Mabuya. I'm an occupational medicine practitioner. As we enter Women's Month for 2020, we are all facing one fear, COVID-19. We shouldn't allow COVID-19 to take over our lives. Pre-COVID-19, we all enjoyed our lives. We knew how to trust, how to love, and how to make mistakes and correct ourselves. COVID-19 has given us new lessons in our lives. What are the new lessons? For workers or employees, we've embraced a new way of working, meaning remote work. Remote work means we don't really have to rush in the morning, trying to beat the traffic to be at the office at 8 o'clock and finish at 5 o'clock. Remote working allows us to be more structured and maybe developing a routine for ourselves on a daily basis, where you wake up at a certain time, maybe 6 o'clock daily, you do a workout, you can test yourself, weigh yourself, then shower, and then start your virtual meetings daily at 9 o'clock.
My name is Dr. Shingai Nyaguse Churunge. I'm from Zimbabwe, representing the Senior Hospital Doctors Association.
Hello everyone, my name is Laura Mkanate. I'm a professional nurse. I work for the government of Lesotho in the Ministry of Health. I am currently taking care of health professionals that have been infected with COVID-19.
Good morning everyone. My name is Dr. Gada El-Kanzouri. I'm the deputy for the Association for the Private Healthcare Providers of Egypt. I'm also a board member for the Federation of Egyptian Industries, and I'm a board member for Ganzouri Specialized Hospital.
Hello everybody, my name is Dr. Cynthia Sateha. I'm an orthopedic hand surgeon from Johannesburg, South Africa. As we are all trying to navigate through this global pandemic, the COVID-19, I find that the biggest problem, or one of the biggest problems, is mental health issues. So how does one keep positive amidst this anxiety, this uncertainty time that we have? So how I cultivate a positive mind and spirit is through looking at three things. So myself as an individual, the supportive structure that I have, which is the family and friends, and then looking at the colleagues I'm working with and the patients that I'm serving. So myself, I make sure I am spiritually fit, mentally fit, physically fit, spiritually being the most important. So I'm grateful every day that I'm waking up, that I'm still breathing, that I'm still here, and I ask the universe, how can I serve you today?
Good day everybody, my name is Dr. Malebo Mokotedi Mapiloko, and I'm the Managing Director of MediWell Denford Medical Center and the Director of MediWell Digital Health, as well as a member of the Medical Women Association for South African Doctors. So one of the major challenges that we found during the COVID-19 pandemic was that there was a decrease in the number of patients that were physically coming to see the doctors. And as doctors, we had to actually think out of the box so that we can continue providing quality healthcare to our patients. And this is where we have learned to embrace telemedicine. Telemedicine has allowed us to have a broader reach for patients and also has enabled us to act quickly with patients, because these are patients who would have had to make an appointment, found transport to come and see us, but now we're able to consult with them in the comfort of their own homes. And I think what's exciting about this is that, as doctors, we're clinicians, we want to use our hands, we want to touch our patients. However, I found that this, innovation and thinking outside the box has allowed us to be able to screen more patients so that those who indeed need to come and see us are able to do so.
I am Diteba Libusa, HIV/TB frontliner from Lesotho. Greetings everyone. We are in an exceptional era whereby the whole world is held and hosted by this novel pandemic, COVID-19. And indeed, overwhelming era on the shoulders of each and every healthcare worker serving as a frontliner in this battlefield against COVID. But oh dear frontliner, as weak as you may be feeling, as devastated as you may be feeling, take note of this. In the past few months, you've been nothing but pure gold. You've been nothing but the greatest source of inspiration for our societies and our communities. Now, as I shift my attention back again to them, I see them today still trusting us and seeing us as the only hope out of this hopelessness, seeing us as the only light out of this darkness, seeing us as the only salt out of this bitterness. It is therefore my plea that we continue in creating and building this greatest legacy.
Hi everyone, my name is Dr. Sana Said and I'm a physician based in Zanzibar, which is a small island off the coast of Tanzania. I'd like to give a word of hope, most especially to our young doctors who've just joined the medical field. Sometimes it can feel tough, sometimes you can feel like you're on your own. I just want you to know that it may feel like you cannot change the world, but you can change one thing at a time. And it's important for you to realize that what you can change, then you should change, because change is gradual. It doesn't happen in one day. But all these things can be done if we have hope and we work together as a team and we have faith that things do get better with time. I just also want to remind you that the medical fraternity, your senior doctors, they're out to support you. We want to see you doing well. And we will bear through this pandemic, which has brought the world to its knees. But we're in this together and we should all power through. At the same time, it's also important to have a good support system. Your friends, your family, keep them close. When you feel down, it's important to reach out and talk to those who understand you, who give you hope, who rejuvenate you so that you are able to continue in this fight. Lastly, I'd like to say that we're all in this together. You are important.
My name is Clara Masha and I serve as the president of the Healthcare Federation of Nigeria. There is a way of hope. There has been an opportunity to make a difference, and this has been through strategic public-private partnerships where the private sector has come, provided those essential PPEs, that essential medication as well as infrastructure, and isolation centers and ICU equipment. And as we speak today, we've been able to start to make a difference. The essential testing equipment and tests that are required for PCR have also been provided. This shows the resilience of the human heart.
Hello everyone, my name is Tobile Dlamini. I'm the CEO at Swapture, the private sector response on health and AIDS. During the time of COVID-19, we have had to reorganize ourselves to respond accurately to this pandemic. I am honored for the recognition on this auspicious occasion. Whenever one is asked to share some words of wisdom, often we think it's about ourselves, but it is about the people we serve. We stand on the shoulders of all the people who always allow us to serve them, and I'm grateful to have been that person as we commemorate frontliners in health during the time of COVID-19 and recognize the fallen heroes. I am honored to have been able to serve a number of people. One of the issues that comes out tops during this time is to address the wellness of frontliners, to address the mental health of frontliners, to help them to continue serving even in difficult times. To the population, I want to say, do not panic. Get the right information and help reduce the workload of frontliners by remaining healthy. To the frontliners, remember to also take care of yourself. Make sure you have enough rest, make sure you sleep well and eat well. To the people that we serve, the people that are at home, remember the frontliners for the past 6 months have not been able to go on a holiday, have not been able to work or stay at home. They are at work because they are serving you. So please send a kind word every now and then to any frontliner that you know, just to encourage them, just to let them know their work is appreciated. And to all those that are retired and are in the health sector, please just take time to just share accurate information. I have realized as I serve as an advocate for healthy workplaces that a lot of information that is out there is false and misleading. you can assist by just sharing one message a day. To those that are at home and are currently not working, please just identify one health worker and offer just once a week or once a month to be the errand guy or lady for that frontline. You may do their shopping or their cleaning or whatever. Even just 1 hour relief would go a long way in ensuring they remain healthy to serve you. Mentally, it goes a long way to know there's someone out there who supports their contribution to life and livelihoods. Our motto is healthy worker, healthy business.
My name is Gideon Leboa. I'm a medical laboratory scientist.
My name is Fafa Osman from Ghana, a registered nurse with a 5 years experience.
I'm Purvi Rexford and I'm a medical laboratory scientist.
My name is Gracie Suman and my main area of focus is wellness coaching, dealing with clients in large population centers like offices, banks, organizations that have more than 30 people.
I continue to do what I do because the more I test, the more I work and the more I save lives.
The reason why we carry on and we are trying to reinvent our business strategy is because non-communicable diseases haven't gone away. And with the data coming in, the people who are traditionally my clients or the people I'm trying to rescue from the lifestyles they have are at high risk of COVID.
As the patients come in with dilemma, we can't run away because that is what we train to do.
Among all these challenges, I'm always motivated to go back to work because I believe my work is a calling, an opportunity to bless and help somebody in need, and also to save lives.